Welcome, friends. Revise with me the homeopathic remedy Medorrhinum. This is the 112th remedy on the rule of Allen's keynote. Its the common name is the gonorrheal virus and gleninum as it given in Clark. The remedy is a nosode and the remedy was proved by Dr. Swan. We are going to deal with part 1 PQR review and the text as usual is taken up from Allen's keynote. And this is a very good revision study for BHMS students, interns, and general physicians. I am Dr. V.K. Chauhan, homeopathic physician. Friends, let us go to the book which we are going to follow. Ellen's keynote. This is the front page, and this is the first text which correspond to introduction or generalities of the remedies. And then we find Ellen's keynote, as we can recall, is based on the Hering's guiding symptom and it is given in running text and no grades are given. Each sentence represents a PQR and drawback is text is disorganized in sequence and continuity. Please remember this is not true for the description of Medorrhinum because Medorrhinum has been described in Annan's keynote in the perfect Hahnnemania schema, more or less. So, however, if you go through the text, you will come across many sentences. So we cannot say that there are 10 or 20 sentences are very important. So there are so many PQRs and all are very important for us. So the first PQR we find for the constitutional effects of maltreated and suppressed gonorrhea. When the best selected remedy fails to relieve or permanently improve, it is a causation and elements from which also covers the diathesis with clinical presentation. PQR2 tells us for persons suffering from gout, rheumatism, neuralgia, and diseases of spinal cord and its membrane, even organic lesion ending in paralysis which can be traced to psychotic origin. So again it is a clinical presentation of suppressed gonorrhea, and here they say if you have the history of gonorrhea, hereditary or past history, there can be spinal cord problem and its membranes problem. So spinal cord may have demyelinating diseases, can be multiple sclerosis, can be other conditions like tabes dorsalis, transverse myelitis, and organic lesion ending in paralysis can have two sets. The nerves which are coming from the spinal cord, they also get affected. Say, for example, Guillain-Barré syndrome, where the covering of nerve cells, the myelin sheath, which is from Schwann cells, they are present outside the central nervous system, they get affected. And within the central nervous system, being spinal cord is a part of central nervous system, multiple sclerosis. To demyelinating diseases having two areas within the central nervous system and outside the central nervous system, both can be covered here. Now we go to the PQR3 for women with chronic ovaritis, selphingitis, pelvic cellulitis, fibroid and cyst, and other morbid growths of the uterus and ovaries, especially if symptoms point to malignancy with or without psychotic origin. If there is a malignancy of female genital tract and you have the history of psychosis, good enough, or it can be a spontaneous mutation in soric constitution. Now the morbid growths, like we have fibroid and we have certain development into the ovaries, that can be tumors and cyst, and some of the direct inflammatory conditions can be explained, which is generally caused by the ascending infection from the female genital tract, and commonest example is gonorrhea, where you have ascending infection from vagina to body of the uterus and goes to the fallopian tube. It is going to cause selphingitis, and then once it tickles out inside outside the uh, fallopian tube, it is going to involve the ovaries, so there will be ovaritis, and it is going to involve the pelvic peritoneum, so there will be pelvic cellulitis. Very well, let us go to the PQR4 for serous carcinoma or cancers with acute or chronic in development when the symptoms correspond and history of psychosis can be traced. This is a diathesis. We go to the PQR5, bears the same relation in deep-seated psychotic chronic affections of the spinal and sympathetic nervous system that Sorinum does to the deep-seated affections of the skin and mucous membrane. So every miasm has got predilection of certain areas. The primary presentation of psora is always on the skin and mucous membrane. So Sorinum is the remedy. And if you have psychotic affections, which is going to involve the bones and muscles and nerves, and especially nervous system, it says sympathetic nervous system, spinal cord and sympathetic nervous system. In a spinal cord involvement, you have the paralysis. It can be sensory, it can be motor, but sympathetic nervous system is having a special area where you will find heart rhythm issues. It can be arrhythmia or it can be tachycardia, very fast heart rate, or you have sexual dysfunction, including priapism, dizziness, constipation, and whenever you stand, there is a sudden drop of blood pressure. So these are the things like eyelid droop, ptosis. Ptosis is a sympathetic affection involvement of the sympathetic nerve, part of the nerve, which is going to cause it. So let us go to the PQR6. Children are pale, rachitic, dwarfed, and stunned in growth, like Beretta Karp, mentally dull and weak. So we have mental and physical retardation. Draft children, they can be seen in hypopituitarism, or they can be seen in certain chromosomal disorder like Down syndrome. There are children who have rachitic like deficiency disorder because of the vitamin C. In those days, they have rampant cases of rickets, but nowadays we don't see such cases. PQR7 tells us about the great heat and soreness with enlargement of the lymphatic glands all over the body. So it could be because of leukemia, it can be Hodgkin's lymphoma, it could be non-Hodgkin's lymphoma. So these are the things which are going to affect. But heat and soreness is always present with inflammation. It is generally not a case in tubercular lymphadenitis. Please remember. The PQR8 tells us consumptive languor, fatigue, great general depression of vitality. It is because of the tuberculosis, which can be of pulmonary tuberculosis, it can be pulmonary, apart from pulmonary, it can be GIT, abdominal cox abdomen, or it can be bones, it can be nerve, it can be spinal cord like meningitis, tubercular meningitis. So tubercular infection associated with general depression of vitality. Now we go to the next PQR, that is 9. Pains. The variety of pains here, arthritic and rheumatic pains are there, and that is in sequelae to the suppressed gonorrhea. Similar remedy, we have deafening, odora, clematis. Then we have constricting pains where it is going to seems to tighten the whole body like what we see in cactus, and sore all over as a bruised what we see in arnica and epitorium. So here certain things like arthritis involves the generally the very important part of involvement is the synovial membrane in the joint, capsular joint, ligaments, capsular ligament is involved, and then muscles are also involved indirectly. Other condition is where we have got involuntary, the muscle constriction is vasoconstriction in the cardiac muscles. So there is a autonomic nervous system, sympathetic nervous system, which is going to cause. So cactus is the remedy where the hollow viscera are going to cause pain, especially blood vessels. And sore all over is a bruised, that is like your cutaneous nerve and muscles are involved, where arnica and eupatorium is the remedy. But here all three are involved in Medorrhinum. We have PQR10 trembling all over. It is a subjective phenomena. And it is because of the intense nervousness and profound exhaustion, because there is a arousal state, arousal because of the overactivity of the sympathetic nervous system, and it causes exhaustion. We have PQR11, state of collapse. Want to be fanned all the time like Karbovich, craves fresh air, skin is cold, yet throws off the covers like camphor, sickle cord. And we have cold, bath with cold perspiration like Veratrum album. Generally in those days, such a state of shock used to be common thing in cases of cholera and diarrhea. So it is a hypovolemic shock which is going to give us this kind of symptoms. Now let us go to the mental area, a mind, where we have PQR1. Weakness of memory, cannot remember names, words, or initial letters. Has to ask name of the most intimate friend, even forgets his own name. So it is a memory issue. And memory issue is a recent memory issue. Now we go to the PQR2. Cannot spell correctly, wonders how well-known name is spelled. So here he cannot remember the alphabets. And PQR3 tells us constantly loses the thread of conversation. So he cannot continue the discussion in one particular subject. He jumps from here to there. So there is a you can say his mind concentration is gone. He loses the thread of conversation. So generally we see such a thing in clinically word salad. And we find PQR4 great difficulty in stating her symptoms. Questions has to be repeated as she loses herself, because there is a loss of concentration, there is a no continuity of the thought, no central thread. So generally you have to keep remind him what we are going to what we are going to deal with, what area we are talking. In mental generals we find PQR5 cannot speak without weeping. So there is a weeping indisposition. It is an emotion. PQR6 anticipates death. So there is a thanatophobia, fear of death, and he anticipates that he is going to die. And feels matters more sensitively before they occur and generally correctly. So he has premonition of the issues which are going to take up in his life. Mind PQR7 irritated at trifles, cross during the day, exhilarated at night, very impatient, peevish. So cross during the day, exhilarated at night. So night is the night time, evening time is a good time for depression patients. Generally, depressive patient, they are worse in the morning hours and they get better by the time they reach in the evening and night time, early evening part. So friends, let us go to the next PQR in mental general. We have PQR8. The patient is anxious, nervous, extremely sensitive, starts at the least sound. So there is a starter reflex. He is very aroused. PQR9, mental general, time passes too slowly. So there is a delusion of time sense here. And we have PQR10, is in a great hurry when doing anything, is in such a hurry that she gets fatigued. So there is a hurry also. Mental general, PQR 11. Many symptoms are aggravated when thinking of them. Pain returns as soon as he thinks about them, like oxalic acid. Now let us go to the head region. And in the head region, we have PQR1, intense burning pain in brain, worse in cerebellum extending down to spine. And then we have the second PQR, head feels heavy as if drawn backwards. Head PQR3, sensation of tightness and contraction extending down whole length of the spine. And we have head PQR4, head and diarrhea from jarring of ears. So jarring of ears sound may cause headache as well as diarrhea. Let us go to the throat, and here PQR1 is sensations as if she has taken a severe cold with distressing aching in bones, throat sore and swollen, debilitation of either liquid or solid impossible like we see in mercuries. Second symptom in the head region, throat region is throat constantly filled up thick grey bloody mucus from posterior nares like what we see in hydrosis. So there is a post nasal drip. Appetite. PQR1 ravenous hunger immediately after eating like we find Sina, Lyco and Sorinum. PQR2 tells us constant thirst, even dreams she is drinking, very peculiar of Medorrhinum. PQR3 in appetite, insatiate craving for liquor, which before she hated, like and similar remedy is asaram, for salt is calcarea and natramur, for sweet sulfur, for ale, ice, acid, oranges, and green fruits. So these are the cravings of Medorrhinum. And let us go to the GIT. And GIT 1 tells us stools tenacious, clay like, sluggish, cannot strain from sensation of prolapse of rectum, like what we see similar symptom in alumina. And we have PQR2 in GIT, constriction and inertia of bowels with a ball like stool, like what we see in lachesis. We have the next GIT, PQR is 3, can only pass a stool by leaning far back, very far back, very painful, as if there is a lump in the posterior surface of sphincter, so painful as to cause tears. So these are the symptoms which tell us about the fissure in ano and pain. PQR4 tells us sharp needle-like pains in the rectum. So these are the tearing pains or needle-like pain can be present because of fissure in ano. And PQR5 tells us oozing of moisture from anus, fetid odor of fish brine, like what we see in causticum and Heper. So this is a fish brine odor of discharges is very peculiar of psychotic miasmatic dyscrasia. Let us go to the urinary organs, and the first PQR is severe pain, backache in renal region. So at the renal angles we have pain which is better by profuse urination. The similar symptom we encounter in lycopodium. PQR2 urinary organs we have renal colic, intense pain in the ureters with sensation of passage of calculus like what we'll see in cases like materia medica. Other remedies will be berberis, lyco, osmium, can and associated with craving for eyes. This is a concomitant symptom here. We go to the again urinary tract in PQR3, nocturnal enuresis, passes enormous quantity of ammoniacal high colored urine in bed every night, which is worse by overwork or overplay, extremes of heat or cold, when the best selected remedy fails with history of psychosis. So it is nocturnal enuresis of Medorrhinum. PQR4, painful tenesmus of bladder and bowel when urinating. So this is a kind of a symptom where we have got colitis, symptoms of colitis and symptoms of inflammation of bladder, cystitis. Sexual organs. Generally, we find female sexual organs are predominantly given here. Menses, profuse, very dark clotted stains, difficult to wash out like McCarp. And we have PQR2, metrorrhagia at climacteric, profuse for weeks, flow dark, clotted, offensive, ingushes, unmoving, with malignant diseases of uterus. So let us, friends, go to the PQR3, intense menstrual colic. This is dysmenorrhea with dragging up to knees and terrible bearing down like labor like pains. Must press feet against support as in labor. We have PQR4, intensive pruritus of labia and vagina. Worse when thinking about it. And PQR5 is breast and nipples are sore and sensitive to touch. And PQR6 is breasts are cold as ice to touch, especially the nipples, rest of the body warm during menses. Let us go to the respiratory organs. We have first PQR is the asthma, and here choking caused by the weakness or spasm of the epiglottis. Larynx is stopped so that no air could enter, only better by lying on face and protruding tongue. That is a typical feature of Medorrhinum asthma. PQR2, soreness of larynx as if ulcerated, so it is a laryngitis of Medorrhinum. PQR3 tells dyspnea and sores and sense of constriction. He can inhale with ease but no power to exhale like Sambucus. This is a classical description of asthmatic respiration. And PQR4 tells us about the cough. Cough is dry, incessant, severe, painful, as if mucous membrane was torn from larynx, deep, hollow, like coughing in a barrel, worse at night, from sweats on lying down, better by lying on a stomach is a classical presentation of cough and relief in cases of dyspnea also. Respiratory PQR5 tells us about the sputum. It is albuminous, frothy, small, green, bitter balls, viscid, difficult to raise. And then we have PQR6, incipient consumption, severe pains in the middle lobes. So it is very early subclinical presentation of tuberculosis which is going to get middle lobes. Middle lobe is in the right middle lobe. Middle lobe is not present in the left. Left lung has got upper lobe and lower lobe, and right lung has upper lobe, middle lobe, and lower lobe. Friends, let us go to the back and extremities. We have PQR1. Pain in back between the scapula, whole length of the spine, sore to touch, like what we see in China self. PQR2 tells us intense burning heat beginning in the nape of neck and extending down to spine with a contractive stiffness which is worse by stretching. PQR3, rheumatism of top of shoulder and arm, pain extend to fingers, worse by motion. Right-sided remedy is sanguinaria and left-sided remedy is a ferrum. PQR4, lumbar vertebra painful and sensitive to touch. And then we go to the PQR5, back and extremities, pain in sacrum, coccyx, and back of hips, running around and down the limbs. PQR6 tells us pain in legs from hips to knees only when walking. So this is the area which is sciatica nerve is going to get supply. We have PQR7, heaviness of legs like lead, walking very difficult, legs are so heavy, legs give way. And we have PQR8, lower limbs ache all night, preventing sleep, intensely restless and fidgety legs and feet. So it is looks like a rheumatic pain, but we know this condition is restless leg syndrome we generally see nowadays. And then PQR9, terrible suffering in legs and arms during an electrical storm is a peculiar Medorrhinum symptoms. Let us go to the 10th PQR in the back and extremities, aching in legs with inability to keep them still in bed, which is worse when giving up control of himself when relaxing and trying to sleep. And again, it is a leg syndrome, we can say, having this feature. PQR11 tells us coldness of leg and feet, of hands and forearms. Back and extremity, PQR12, drawing, contracting sensation in hamstring and ankles, cramps in calves and soles. We have PQR13, ankles easy return while walking like in carboanemilis and ledum. And we have PQR14, burning of hands and feet, wants them uncovered and fanned, like electrolysis and sulfur. So it is a burning feet syndrome, which is because of vitamin deficiency, probably vitamin B6 deficiency. And let us go to the PQR 15 amongst entire loss of nervous force in the legs and arms, exhausted by slightest effort. It is a paraplegia, a spinal origin paraplegia. Back and extremities, PQR 16, painful stiffness of every joint in the body. Every joint in the body is arthritis, and small and big joints usually get involved in rheumatoid arthritis. We have PQR 17, deformity of finger joints, large puffy knuckles, swelling and inflamed stiffness of ankles, great tenderness of heels and balls of feet, swelling of all joints are puffy like wind galls. So here, deformity of the small joint, large, puffy. So this is the puffy is the pannus formation. This is the first stage of the rheumatoid arthritis where the disease is in the initial stage is reversible. Once the puffiness is gone, the fibrous tissue, capsular joint is fibrosed, then there are deformities and it is a permanent deformity. It is a irreversible changes are going to take place. So it tells us that the deformity of the finger joints, which is large and puffy, uh, it is an early stage of a rheumatoid arthritis, where bilaterally symmetrical small joints are affected of the hands. So it's a classical presentation of rheumatoid arthritis here. Now the relationship, let us compare ipecac in dry cough, camphor, cecal tabacum, and verbascum in collapse, veratrum album in collapse, picric acid and gelsemium in inability to walk because of the weakness, paralytic state, and aloes and sulfur in the morning diarrhea. The burning feet of sulfur and restless fidgety legs and feet of zinc are both found in the same time in Medorrhinum. That is the distinction of this remedy here. The modalities, aggravation, when thinking of it, helonias and oxalic acid, heat and covering, stretching, thunderstorm, least movement, all aggravate. Sweets are also going to aggravate. From daylight to sunset, daylight to sunset, it is reverse of syphilinum. Syphilinum is worse at the night. Sunset to sunrise and daylight to sunset is Medorrhinum. Psychotic classical modality. In amelioration we find at the seashore rivers of natrum and lying on stomach and damp weather classically in rheumatic complaints damp weather is going to aggravate, but here it ameliorates like in cases of causticum and nux vomica. Friends, thank you very much for watching and patient listening. The sharing is caring.